Hello, everyone. This is Dr. Richard Fleming, and today is Saturday, October 3rd, 2020. Today's topic is consistency. In listening to many of the conversations about masks and vaccines and SARS-CoV-2 or COVID-19, I'm reminded of the fact that most people are inconsistent in their arguments and discussions. They're as inconsistent in these discussions as they are about the death penalty and abortion. And while it's not a comfortable topic for most people to listen to, particularly if you're opposed to the point of view of the person presenting the information, consistency has much to do with the validity of a person. For example, Republicans believe that it's incorrect to perform abortions, but they are pro the death penalty. From the point of view of life being important and valued, that's inconsistent. Democrats, on the other hand, are anti-death penalty, but pro-abortion. Again, inconsistent for the argument of the validity and importance of life, but from the opposite point of view. Is it any wonder that these two sides can't get together to fully extend an appreciation for the validity or the absence of validity for life? So too it is with COVID-19. Take the mask scenario. Those individuals who would argue that masks have no benefit are quick to point out that the size of the virus, when it's not associated with particulate matter like coughing or sneezing, is smaller than the size of the openings of the masks. And therefore, the masks cannot possibly stop the virus, so let's take the masks off. These same individuals would argue that wearing the mask is a problem for immunity because it retains carbon dioxide from the air breathed out by the person and doesn't allow oxygen to come in through the mask as is needed. This argument is as full of fallacy holes as the mask is, because the size of the virus, while small, is larger than the size of a molecule of carbon dioxide or oxygen. If the masks do not prevent the movement of the virus in and out through the mask pores, it certainly has no effect on gases like carbon dioxide and oxygen. The same argument is true for vaccines. In a discussion that I heard just yesterday, the individuals were attributing terrain theory as a full explanation for the presence or absence of viruses. Now, when people use the term terrain theory, they don't mean a healthy body, which is, I think, sometimes the confusion. A healthy body is key to health, and a diseased body is problematic, particularly for people with COVID-19. But the terrainers would have you believe that the source of viruses, bacteria, and fungi is not something outside of the person, but a change in the cells of the person, whether that's red blood cells, which is one pleomorphic theory, or exosomes, or any of a variety of pulling an idea out of thin air as possible. Now, that being said, they believe that the viruses then are there to let you know that something is wrong because you've either been exposed to 5G or toxins in the environment. So they believe that the body makes things that produces an immunologic response, which is dangerous to the body in response to something, a toxin, an environmental toxin, or 5G that they would argue is also dangerous to the body. In fact, some of them simply claim that COVID-19 is nothing but hysteria-induced changes. They then go on to discuss how viruses are important and that they believe that the viruses actually help to change the genetics of individuals, helping to speed up the evolutionary process. An interesting thought, because it is true that it is the belief that humans have the cognitive mental reasoning skills because of a virus that infected Neanderthals some time ago and didn't infect the other primates. So from that point of view, there appears to be some benefit to viruses coming in, and there is undoubtedly a role that viruses play. But if vaccines introduce these viruses, and the argument is that these viruses are being produced by the body to help the body, then the Terrainers should welcome with open arms the idea of vaccines. It speeds up the process, particularly their evolutionary theory one. If, however, the viruses are actually something naturally occurring, or in the case of SARS-CoV-2, a human modified naturally occurring virus to give it increased ability to infect people through gain of function, then you would have a good argument for not wanting these viruses to be spread around. And you would have a good argument for not wanting to vaccinate people if it produces an immunologic response that is life-threatening. And that is, as I think most people would argue on either side of the theory, what's responsible for some 96% of the deaths, the immunologic inflammatory thrombotic response to the presentation of the viruses. Either vaccines are beneficial or not, either masks are beneficial or not, either life is valid and important to be preserved or not. But the consistency of the argument is all telling. Another thing that's all telling is how poorly these individuals articulate the words. Now, please don't take that as arrogant. If you've been educated and worked in a field and you mispronounce a word because you've read it, you will be corrected by the people that are training you and responsible for you getting your degrees. If you're just reading it from what somebody else has published, which by the way is not research, it is looking at what somebody else's research shows, but it is not itself research. It's simply a collection of what somebody else's research is. If you're just reading it, either from somebody else's research or from a textbook or from the internet, you will not learn how to pronounce the word. And when people consistently pronounce words incorrectly, reproducing those words over and over and over again incorrectly, it's obvious they haven't been trained. They've been reading it. A major difference between people that are educated is their articulation of the words and their consistency in their arguments. Something for everyone to think about as we're dealing with COVID-19 and everything else during this season of debates and presidential and lower office elections. Thank you. Have a good day. I look forward to speaking with everyone again.